Hi, my name is Stephanie Garner, and I'm the program coordinator at Down Syndrome Indiana.
And I'm Becca Kempson. I'm a volunteer with Down Syndrome Indiana, and I'm also a registered nurse who practices in labor and delivery. We're really excited to have you guys here for our webinar on how to deliver a Down syndrome diagnosis using best practice standards.
So before we begin, let me tell you just a little bit about Down Syndrome Indiana. So Down Syndrome Indiana is a not-for-profit, and our mission is to enhance the lives of individuals with Down syndrome. We do that in a variety of ways. One of those ways is to provide new parent packets to families who receive a Down syndrome diagnosis, either prenatally or postnatally. We also do a lot of one-on-one connections through our First Call program. So a new family could call in and get matched up with a mentor family who could talk to them about having a child with Down syndrome. We also do small groups, which we call community groups. We have several throughout Central Indiana. And we do a lot of large-scale awareness events and activities like our World Down Syndrome Day celebration and our Buddy Walk, which happens the second Saturday of October. Oh, let me tell you a little bit about why we're here. We'll share our stories. So I got involved with Down Syndrome Indiana about 6 years ago when my daughter Lily was born, and we had a surprise diagnosis. Had no idea that Lily would have Down syndrome, got a postnatal diagnosis, and it was a really scary time for us, very overwhelming. There was a lot of fear of the unknown, and I was one of the really lucky people. So my doctor presented the diagnosis in a really kind, compassionate, and caring way, and had a good story, but it was still very scary and very overwhelming. So that's what brings me here, because I want to allow other moms to be able to have a really great diagnosis experience.
Yeah, and I am here with us also because of my daughter, Pepper, and you can see her in the pictures. She is now almost 3 years old, and our little Spitfire. She is just a wonderful joy to have in our life. And we also had a surprise diagnosis postnatally. We had no idea that she had Down syndrome until she was born. Mine is a little bit of a different story because I was able to look down at her and diagnose her myself. But again, just like with Stephanie, I would love to help parents both prenatally and postnatally have a good experience of getting that diagnosis. So I want you guys to think about either when Kennedy was assassinated or when 9/11 happened. Just take a minute to close your eyes and imagine what that moment was like in your life. So now that you guys have thought about it, I'm sure you're thinking, that was a pretty big moment in my life. I know exactly where I was, what I was doing. These are called light bulb moments. These moments define part of our life, and they also can affect how we feel for even the next few weeks or months in our life. And they're a big deal. We're going to remember where we were, what we were doing, how we were doing it, how we felt. And they're going to pop up at different times in our life. Just as you guys being providers, I want you to realize that when a parent gets a Down syndrome diagnosis, this is a light bulb moment. It is something that changes everything for them. They're going to remember what they were feeling, even smells in the room. They're going to remember all this. And how you present this diagnosis can affect how they feel about it again the next few weeks, months, years of their life. So I just want you guys to remember that. So as we move into this next slide, I just want to talk a little bit about some research that has been done by Dr. Brian Scottco. And also some of his colleagues on how to deliver a prenatal screening result for Down syndrome. So for what he has found, best practices for this is deliver it. So I should have started out as saying we are going to start out with the prenatal diagnosis. So with the screening results, you want to present that as soon as possible. You don't want to be waiting weeks for the next appointment for this parent to find out that there is a high likelihood that their child has Down syndrome. Also, what is preferred is that they're in the company of their husband or partner. You want to also make sure that you're explaining the difference between a screening and a diagnostic test, and also indicate that the results will come as a probability assessment and not a positive negative when you are doing the screening results.
So where is the best place to deliver that diagnosis? Well, we know that a personal visit is going to be ideal, but in a busy medical practice, that's not always possible. So the second best, I guess, is to do a phone call at a pre-established time. So we recommend that when you're taking that sample, that you schedule a time with that parent. So let her know maybe next Friday about 3 o'clock, we'll give you a call. That way that mom can be somewhere with their spouse or a partner or support person, kind of in that safe environment. Because we've heard a lot of horror stories about parents who get the diagnosis, while they're in line at the grocery store checking out, surrounded by people and strangers, or driving down the interstate, or at Disney World. We want to make sure that they are in a safe place where they can really cope with that news. And then we always want to follow up with an office visit. So what information do you want to give when you're giving that diagnosis of that prenatal screening? Number one, you want to make sure you're giving up-to-date information. So providing them with the up-to-date healthcare guidelines, up-to-date expectations of what life is really like for someone with Down syndrome in this day and age. Definitely discuss the causes of Down syndrome as well, because I think there's a lot of confusion out there still. A lot of moms feel like it's their fault, and so just being able to really put their mind at ease, I think, is important. Also discuss expectations. So, what will the delivery look like? What will the next few months look like, or the first couple years of that child's life? But definitely don't overwhelm that parent. So while we definitely wanted them to know what's coming, this isn't necessarily the appropriate time to talk about the fact that their child has a chance of developing Alzheimer's at an earlier age. Definitely don't overwhelm them. A bibliography is really important to give that new parent. The first thing that we all do when we get a new diagnosis is we go home and we Google. So when you Google Down syndrome, some not so good stuff can come up. So make sure you're giving that new parent some resources, places they can reach out to learn more about that diagnosis. Share personal stories with that family. So if you know someone with Down syndrome, or have a family friend, talk about that person, or talk about other patients that you've had who have children with Down syndrome, and share those uplifting personal stories. And then make sure that you're discussing options. There have been some studies out there. Medeo in the American Journal of Medical Genetics did a study of genetic counselors, and he found that while genetic counselors absolutely appreciate that people with Down syndrome can have friendships and have jobs and go to school, very few of them actually shared this with new families. And then while 95% of genetic counselors talked about the biomedical aspects of Down syndrome, only about 26% talked about the social aspects. And definitely talk about those options, because it's really important that you talk about all three options when you are talking prenatal screenings or testing. Termination, continuing the pregnancy, and adoption. I think very often when that new mom hears, well, you can terminate if you want, they walk away feeling like termination is the option that physician is really pushing for, when in fact the physician was just making sure that mom knew that was an option. So definitely you want to say all three of those options when you are presenting that Down syndrome diagnosis.
Right. So I think sometimes, you really want to have that informed consent with them. So you feel like, well, they know they can continue the pregnancy. They know that they can put this child up for adoption, but do they know that they are able to terminate? So I don't think that you guys are, out there saying, I want this baby terminated, but you just have to realize that's what the parents are hearing when that is the only option that you mention. So really make sure that you're saying, okay, yes, you can terminate. You can also continue the pregnancy, and you can also put this child up for adoption. And just so you guys know, if the parent is on the line with adoption, realize that in the network that there is a wait list of parents wanting to adopt babies with Down syndrome. So that's something to remember, that these babies are not going to, straight into foster care where it's, back and forth with all these different families. There's loving parents that are ready to take care of these children. So also that just brings me to more research on things that you can share prenatally, and also how you come across. So Scott Coe has also done other research with some of his colleagues on just, what does an adult with Down syndrome, what do they think, what do they feel? So nearly 99% of individuals with Down syndrome say that they are happy with their life. 97% said that they are happy with who they are, and 96% that say that they are happy with how they look. Now, if we think about the general population, do you really think that's even close? No. So, I know that sometimes it can seem very sad for parents to get this diagnosis, but you have to realize that in the end, it doesn't have to be just a sad thing. I mean, these people with Down syndrome, 99% are happy with their life. And I think that's something to remember when you're sharing this news. Also, just more research has shown that parents of children with Down syndrome actually have lower divorce rates compared to parents of either non-disabled children or a different disability. So if you look at these divorce rates, you can look on our slide, 7.6% for parents with a child with Down syndrome. It jumps up to 10.8 of a parent with a non-disabled child, and then it jumps up some more to 11.25%, or excuse me, 11.25%. With parents with a child with another congenital birth defects. So I think that's something to remember, that these families are enjoying their family life. They're staying cohesive even with this diagnosis, and it's actually a lower rate.
Absolutely. So when you do have to present that diagnosis, you want to make sure that you are communicating the news in a very respectful and non-judgmental way, and that you're using language that's sensitive, neutral, and very non-directive. Now, we always debate whether or not to include this slide in our presentation, and Becca and I have chosen to leave it in here because we feel like it's really important to talk about the things you don't want to do when you're giving that diagnosis. And that is because sometimes we're doing these things unintentionally. Maybe you don't realize this isn't appropriate. So we definitely want to talk about the things not to do. Number one is don't use offensive terminology. So mental retardation is no longer an appropriate medical diagnosis. The appropriate diagnosis is intellectual disability. Along those lines also, you want to make sure that you're using people first language. So rather than a Down syndrome baby, this mom is having a baby with Down syndrome. So when you use people first language, it really helps to empower that family and a person with a disability as well. Don't rush that parent into decision making. I know, especially when you're talking prenatal diagnosis, if that parent is considering termination, there is a window of time that is a viable option. But make sure that you are allowing that parent as much time as possible to make that decision. Don't give that parent unsolicited personal opinions. So for example, I have in the past talked with a family whose physician, upon making the diagnosis, told her that her baby wouldn't walk, her baby wouldn't talk, her baby wouldn't have a good quality of life, and her baby would decrease her quality of life. Those are all very personal opinions that are absolutely not appropriate to be sharing with that family. And then don't try and change that parent's decision once they've made it, whether they're choosing to continue, to terminate, to adopt. Support them in those decisions.
So now we've talked a lot about the prenatal diagnosis. Now, some of those things you can use for a postnatal also, but we do want to just talk specifically for the postnatal diagnosis also. I think the first thing to remember is say congratulations, you have a beautiful baby. It is really okay to say congratulations, and it's a must. This family, just like anybody else, just had a baby, and they need to know that it's okay to have joy in that. Don't apologize. You don't need to say sorry. And it's okay, though, to understand that this family is going through something big and it's going to be something hard for them. So saying something more like, I know this is a lot to take in, things like that are going to be more helpful in helping them open up and start to talk through what they're going through with it. I can't stress this next point enough. Please encourage these parents to get in contact with parents who have a child with Down syndrome. It is such a good support network to have that, to have other parents that understand what that light bulb moment feels like and what the next few years is going to feel like. So I really encourage you to get them in contact with somebody if you don't know somebody. We'll talk about that a little bit later about how you can get in contact with somebody like that. And also make sure that you're using the word chance as opposed to risk. This child has a 50% chance that there will be some heart issues, and that sort of thing. Risk just, I think can ramp up that anxiety and that sort of thing. And also use current medical facts. I mean, these parents do need to know what tests are going to be going on with their child in the next few days and why that's going on. Give them those medical facts. Just make sure, again, that you're saying more of that congratulations to and not saying I'm sorry with it. So who is the best person to deliver this news postnatally? You. I think that's the big thing. A lot of, we're hoping to reach out to a lot of OBs especially, and other doctors. So I think what you want to realize, if you are an OB listening to this, you have a rapport with this patient. You've been with them this entire pregnancy. They know you, they trust you. And I think sometimes it can be tempting to let the pediatrician take care of this. Again, if you're a pediatrician listening, sure. If you're already there, go ahead and say it. But I do want to let those OBs know. If you know right then, please just go ahead and share. You've heard our presentation. You know what's appropriate. So I just ask that if you have a rapport with the patient, they're going to take it better from you. So, of course, it needs to be overall, it does need to be a healthcare professional that is sharing this, someone with knowledge of Down syndrome, how to share it, and somebody that's going to be sensitive, accurate, and have a consistent message with the other people. So again, if you're a nurse listening to this, please don't hear me saying that you're not important in this. You also have a place because you need to give a consistent message. And you can also, I don't want to say do the cleanup work. I'm really hoping that physicians are doing a good job of giving this diagnosis. But if you do hear things that, are not accurate or are not helpful, then you can be the one that comes in and really shows that compassion. I have had other parents say that the nurse is what really made them feel better about what was going on. So as a healthcare professional, no matter if you're a doctor or a nurse or a genetic counselor, each of you has a place in this diagnosis.
Absolutely. So just to kind of wrap things up, these are our suggestions as moms, what we would like to see from you guys. So number one, make sure that you are researching your local Down syndrome organizations, whether you're watching this in Indianapolis or other places around Indiana or around the country. Do some research ahead of time, know your local resources that are available, and have a list of those to give to new parents. Make sure you're getting personal experience. It means a lot to a parent for you to say, oh, well, I volunteered at the Buddy Walk one year and I met some really amazing individuals with Down syndrome and their families. I want to get you in touch with them. So if you don't know people with Down syndrome, reach out to your local Down syndrome organization and get some firsthand knowledge. At Down Syndrome Indiana, we are always looking for volunteers to come out and help with different events. So we will gladly get you some experiences. And then have a first call list of your own. If you've got friends who have children with Down syndrome, ask if they'd be willing to talk to your patients, maybe former patients who've had a child with Down syndrome. Keep a list of those patients, and when you do get a new diagnosis, reach out to those families and say, hey, would you be willing to talk to this new mom? Or reach out to Down Syndrome Indiana. We'd love to talk with you. We'd love to help connect your patients to other mentor families. And then make sure that you are providing well-rounded information. The medical side of things is incredibly important, having that current up-to-date information, but don't forget about all of the social aspects that are really important to that family as well. All right. So we really appreciate you listening and tuning in today. If this presentation is something that you would like us to present live, we would love to come to your office and talk with your staff, or to your hospital and talk with attending physicians. To schedule that, you're going to either email info@dsindiana.org or call us at 317-925-7617. And lastly, I'm going to leave you with just a few resources. Reese's Rainbow and the National Down Syndrome Adoption Network are groups that work a lot with adopting babies and children with Down syndrome. And if you want more information about how to appropriately make a Down syndrome diagnosis, you can go to the National Center for Prenatal and Postnatal Down Syndrome Resources, lettercase.org, Down Syndrome Pregnancy, or Brighter Tomorrows. So thank you so much, and we look forward to hearing from you in the future.
Thank you.